Dr. Navneet is going to talk on happenings in phaco surgery.
Good morning, respected chairperson and colleagues. Happenings in the phaco surgery, the things can happen with anybody, anytime. Video start. There are very few conditions I am just showing. This we are taking limbal incision, and what happened, see here. Suddenly crescent entered. It's not a simple situation to tackle because the opening is different and you have to do phaco surgery after that. So then the whole procedure change. You have to, instead of side port, you have to use the main port for the preparation of the capsular access. And here it is the discoloration, which is the very important prior to surgery, that anterior chamber should be with the one solution only. It should not be mixed with the many solutions. All these things can get mess, but we can manage. But this has happened and we have to tackle. We have to remove out the bluish discoloration. And this is the very important step. You go in the entry and try to find out, and it should be 2.8 or 2.2, whatever we decide. Another case, mature cataract. And there is a stretching. You can see the two folds of the, suddenly this thing can happen. So there is a stretch on the zonules. We can manage, we can complete the capsular access, but most important thing is that we have weakened that zonules. So all the pressure during the next steps we have to avoid in that area. That is the intention of this presentation also. Things can happen, but you have to be focused that this zone is weak now and we have to tackle. I was removing the nuclear pieces and suddenly I noticed the bluish discoloration in the vitreous cavity. Because sometimes it may be excessive use, sometimes it is the micro leakage, sometimes is the micro zonular weakness in one quadrant, we don't know. But you have to be careful, you cannot do anything else. This has happened with me in 2007 at Jordan when I was doing live surgery. I have put PMMA lens at that time, by scared. Now here, now this is happening every day, but you have to be careful and you have to tackle. During the irrigation aspiration, all these situations has happened due to our fast, quick mind, quick movement. Sometimes we are in a hurry to finish the one case to second case. And I was completing, and suddenly I catch the PC. It's just simple direction of your IA cannula, change little bit downside and you catch PC. A very simple case was going on and this thing has happened. This is another case in a finishing step. I have put the lens. I was comfortable. I was talking with the patient. Patient was known to me that everything has went well and you are all right. I was just doing simple irrigation and see the thing. Everything was looking okay. See, suddenly the back came out. I don't know what to do at that point. And just keep patience quietly. Suppose immediately we start thinking of CTR, this thing, that thing. A very simple trick I have thought, that just we will put the fluid first chamber, make the chamber normal, and just put the fluid towards the direction of the back and it gets settled. That's all. So anytime anything can happen, and then it is the tense eyeball everything went back and the thing has finished. Yeah. 1 minute. Yes. Yes. There was a thread in the cannula. I have removed it. This is the just one case I am showing 8 days before, 10 days before I was doing. So that is the first happening in that case. Then again, I was trying to do and suddenly nuclear piece has come. So up to the last moment you don't know what is going to happen, and this is always I try to tell during my surgical training program and all that. Those after 5 years, 10 years also people are coming for training. I just salute them, but then I teach something different. You should feel the surgery. When I saw that this case was a hypotony, so these events will be happen till last moment, because in hypotony pieces can go in the angle and anywhere. And when you start in a finishing step, especially if it is a fast cutting machine, some small piece like this will go. So happening in phaco surgery is such a topic is that can happen. I have a collection of 200 to 250 cases. Everyday thing is happening. I am just recording, and now that collection has started, and that will be helpful to all. This is just to share. Thank you. Thank you very much.
Thank you, Doctor.
Dr. Navneet, just one thing. That you
while
should.
the comments are going, I would request the next speaker to just get ready on with his talk on the podium. That is Dr. Sataraj.
Yeah, Dr. Navneet, you were showing that case of dialysis, which you try to settle with just with the fluid only.
Yeah.
But I just shared with you, like once the zonules are broken, because that's why only dialysis happens. So that doesn't settle. But it is always better to be on safer side. Just put a CTR ring with the IOL in place, so that will be settling in a much better way and safer way, that will be long lasting. Because once you fill the bag, that will go back. But once that bag is not that inflated, so again dialysis will come forward. So it's better to put a CTR. Yeah, thank you.
Those are very, very nice cases, everyday cases which we all encounter. So while he's getting set up, a little bit of discussion on the first case you had, premature entry in SICS. I would just suggest not to overinflate and just general, not with regards to what you did, general tips about not to overinflate the whole chamber, because then the iris starts coming out and that's where things go downhill. And when you caught the PC, I could see that there were the shadows of the drape, eye drape. That's also very common in our situations where the eye drape, just comes and disturbs us in our visualization. So just keep the eye drape.